Hi, my name is Halito T. Patidungan from St. Augustine School of Nursing, Iloilo branch, under the Caregiver program. Today I'm going to performing the NGT tubing. NGT tubing is a tube that is inserted through the nose, down the throat and the esophagus, and into the stomach. It can be used to give drugs, liquid and liquid food, or used to remove substances from the stomach. The purpose of NGT tubing is to provide feeding, to irrigate stomach, for decompressions or drainage for the gastric substance, to administer supplemental bleeding, to monitor gastrointestinal bleeding, to promote healing after bowel surgery, to help treat an intestinal obstruction. The articles and equipments that we need to gather is the Nasogastric Tube, disposable gloves, lubricant gauze, to lubricate the tip of the NGT tube, or disposable bowl to be used in the event of vomiting, paper towel to allow the patient to wipe around the mouth if needed, a large sterile 10 milliliter to obtain and aspirate from NGT tube, and pH testing strip to assess the pH of the aspirate, dressing to secure the NGT tube, glass of water for the patient as swallow as them safe, local anesthetic spray to numb the oropharynx, apron, marker pen, stel 3, clamp, stethoscope, kidney tree, cotton balls, or adhesive tape. The procedures we need to inserting the NGT tubes is a safety also or considerations. To perform a hand hygiene, check for the additional precautions, introduce yourself to the patients, confirm the patient ID using two patient identifier, for example, name and date of birth. Hi, sir. May I know what's your name, sir, and age?
Joshua Lima, 27.
Thank you for the information. And explain the process to the patients. Offer the analgesic, bathroom, etc. Listen and attend to patients' clues. Ensure the patient's privacy and dignity. Assist the ABCCS actions oxygen safety. Apply the principle of asepsis and safety. Check the vital sign and complete necessary and focused assessment. Let's state the procedures. First, perform the hand hygiene and gather supplies. Visualize, inspect nasal and oral cavities. This is to prevent the transmission of the microorganism and check for the sign of infections or the skin breakdown. Assess for the best or nostril before you begin. Do the occluding one side and asking the patients to sniff, ask the patient about the previous or injuries or history of debated symptoms. Hi, sir. Do you have any history about your disease or your no? Okay. Palpate patient's abdomen for the detentions or down and or the rigidity. Accurate for the bowel sounds. This is to document the assessment finding and determines the appropriate of NGT insertions, relate and the reason for the insertion and the patient's physician's assessment. Tell me, sir, if you hurt or no? Assess the patient level of consciousness and understanding of procedures. Patient must be able to follow the instructions related to the NGT insertion and allowed for passage of tube through nasal and gastrointestinal tract. Check the doctor's orders for the type of NGT tube to be placed and reason for the placement. This is for the check with appropriate orders relevant to the patient's safety. Check the doctors for the type of determine whether the NGT is to be attached to suction or a drainage bag. This is to show that it become measured with the reason for the NGT tube. Position the patient sitting up at 40 degrees to 90 degrees unless contraindicated by the patient's condition, with the pillow under the head and shoulder. This allows raise the bed to a comfortable working height. This will prevent the biochemical injury to the health of care provider. Agree on a signal the patient can use if they wish to pause during the procedure. This procedure can be anxiety provoking and uncomfortable for many patients, providing means for the patient to communicate a discomfort and a desire to pause during the procedures and help the alleviate anxiety. Place a towel on patient chest and provide the facial tissues and tissues emesis basin. Nasal and oral secretions may be the evidence during the procedures. Provide patient with drinking water and in straw if the patient is not fluid restricted. Sipping water through the straw help to initiate the swallowing reflex and facilitate passing of the tube. Stand on the patient's right side, and if you right-handed, and the left side if you are left-handed. You will use a dominant hand to insert the tube. Measure this distance of the tubes from the tip of the nose to the earlobe to the esophageal process, and then mark the tube at this point and determine the appropriate length of NGT to be inserted. Lubricate the tube tip according to your agency policy. Tube may be lubricated internally using tap water or externally using water soluble lubricant jelly. Agency policy varies and should be checked. Never use non-water soluble lubricant, for example Vaseline. It will not dissolve and may cause a respiratory complication if it enters the lungs. Apply clean non-sterile gloves. Cord 10 to 15 centimeter of the end of the NGT around your gloved finger and then release it. Curving the NGT tube around your fingers, it helps it compare to the normal curve of the nasopharynx. Have patients drop head forward and beneath through the mouth. Dropping the head forward closes the trachea and open the esophagus, which allow the NGT to pass more easily through the nasopharynx and into the stomach. Insert NGT tube tip slowly into the patient nostril and advance it steady in a downward direction along the bottom of the nasal passage and pointing downward and direction to the ears on the same side at the nostril. This follows the natural and anatomical alignment of the nasopharynx. You may feel the slight resistance as you advance along the nasal passage. Twist the tube slightly. Apply downward pressure. And continue trying to advance the tube. If significant resistance is felt, remove the tube and allow the patient to rest before trying again in the other nostril. It is common for the patient to feel discomfort, and this may be expressed with a high coughing and gagging. More aggressive coughing and gagging may indicate that the tube has entered the airways, in which case you should withdraw the NGT tube. If there is difficulties in passing the NGT tube, you may ask the patient to sip water slowly through the straw unless oral fluids are contraindicated. The oral fluids are contraindicated, and if the oral fluids, try dry swallowing while you advance the tube. If the patients continue to gag or cough, check the tube is not curled in the back of the mouth. Using a tongue blade and a flashlight to check the back of the mouth, then try if the tube is closed until only the tip of the tube is seen in the back of the mouth. Then try advancing the tube again while the patients try to swallow. Continue to advance the NGT until reach the mark you have placed for a measurement. This ensures accurate placement. Temporarily anchor the tube to the patient or cheek with a piece of tape until you can check for the comfort placement. This prevents a displacement of the NGT tube while checking a placement. Verify the tube placement according to agency policy. Color code pH paper is usually used as an annual and intern check to confirm that the acidic content are present. Then an X-ray is taken to confirm the placement prior to using the NGT for feeding. The content of the aspirated from the tube should be acidic with a pH 5. If the pH is more than 6, it may indicate the presence of the respiratory fluids or a small bowels content, and the tube should be removed. Once the tube's placement has been confirmed, mark with a permanent markers and record the length of the tubing extended from the nose to the outer end of the tube. Aid timely recognition and identification of the tubing displacement or migration. Secure the tube to the patient's gown with a safety pin, allowing enough tube length for the comfortable head movement. This keeps the NGT tube in place. Document the procedures according to the agency policy and report the aids timely recognitions and identification of the tubing displacement or migration. Secure the tube to the patient's gown with a safety pin, allowing enough tube length for the comfortable head movement. This is keep the NGT tube in place. Document the procedures according to the agency policy and report an unexpected finding to the appropriate health care provider. Timely and accurate documentations provide the patient safety. Thank you for watching.